Hi, Dr. Zac Watkins here, functional medicine practitioner, where in my practice I help patients focus on the four top conditions that people are struggling with these days: GI problems, female hormone imbalances, fatigue, and infertility. And today I wanted to get to something that patients of mine have been asking numerous times, and has a lot to do with what we work with in our practice, work with in our office here, is dealing with balancing the stress hormone in our bodies and the response that it gives off. And one of the biggest things, and I'll even say complaints, is that we talk about gluten sensitivity, celiac disease, getting off gluten, and how it relates to a lot of other health conditions and health problems. And so, as you probably saw from the title, one of the things I wanted to say is, can gluten sensitivity or gluten intolerance cause infertility? And I know that, that's a crazy thing to go out there and say and talk about, and in no way am I saying that we need to be diagnosing all women with troubles with infertility that have gluten intolerances. But I wanted to show a connection, and that I think that will help kind of enlighten you and show that there is a connection between everything. And that's my goal, is to show why we're telling women to get off inflammatory foods, the biggest one being gluten, and because of the implications it can have to their hormones, their fertility, health, and things like that. So I'm staying in front of my board because I already wrote this out, because I tried to write it out before and it was just really sloppy. So try not to get too far ahead of me, because I want you to pay attention and to know what I'm saying and take this in as it relates to your health. This doesn't have to be complicated or overwhelming. It's very simplistic in nature when you think about it, and that's my hope and goal for you, is to find this connection, to show you that there is this connection between food intolerances, namely gluten, and fertility health. So what does this mean, and how does this apply to you? So the way I talk to, in this case, women specifically, and why it's important, is gluten is such a inflammatory food. It's modified, it's been changed, the protein structure, that our GI tract, especially the immune system in the GI tract, doesn't recognize it very well. So it has a very hard time with digesting and with processing what it is. I explain it like you swallowed a Rubik's Cube and your immune system is trying to figure it out. It's taking forever, it can't figure out the different protein sequence. And because of that, that's an inflammatory process, especially maybe with someone who has underlying GI inflammation. And that could be anything from constipation, gas and bloating. Those are all things that we should not be having. So you don't have to have overt just terrible GI disease or pain or problems like that. You can have minimal things like gas and bloating after you eat, constipation, things like that. So, getting into, you've probably heard of celiac disease, where someone is their immune system has basically an autoimmune reaction to gluten, and that's a very big no-no. And that's kind of a different topic for a different day. Autoimmunity is basically your body breaking down itself due to a trigger, in this case gluten. Well, you can have what's called gluten intolerance, gluten sensitivity, and it's often, it's all the time, not really looked at or diagnosed. Celiac disease is diagnosed, and I'm glad that that's out there. Gluten intolerance, gluten sensitivity is not, and overwhelmingly most of the people I work with have some kind of issues with gluten. Now, genetically speaking, I think if they don't, that's going to be fine, and that's a whole nother story. But when we're trying to make differences in our health, in my office, we want to take away all the barriers that may be there, gluten being the biggest one by far. So this protein comes into our bodies. This goes for other food intolerances and proteins, which can trigger this inflammatory cascade, but we're specifically talking about gluten because it's such a big problem. And I might add that there is research that backs this up. There's been research overseas in Europe that has looked at the connection between things like gluten sensitivity and fertility among women. So this protein that we eat gluten, which is in breads, pastries, cakes, cookies. It's in Twizzlers. It's pretty much everywhere. It's a good preservative, so it's used quite a lot. And the foods I just mentioned are pretty common, even candy. And you get the bread basket at out to eat. We make sandwiches, and so there's lots of gluten in the average American's diet. And this protein, this food gets into our GI system, and if the GI tract is having a hard time digesting it, and the immune system is having a hard time recognizing it, the Rubik's Cube thing, this is what leads to what we say GI inflammation, increased GI inflammation. So increased inflammation is like a low-grade fire, if you will. The GI tract, the lining becomes very bothered, becomes inflamed. We don't digest as well. Again, we get more gas and bloating, even pain, things like that. And that's what sets up this stage for inflammation. Okay, so we'll start with that. So the increase in the GI inflammation, what that does, the physiological process, what happens next is it tends to increase our stress hormone, and in this specific case we're talking about cortisol. And if you need a refresher about cortisol and adrenal gland health, please view my other videos on the site going into more detail about that. And basically, this inflammation, any kind of inflammation, whether it be trauma, whether it be burn, that's inflammation. Even metabolically, our tissues that break down and metabolize, that can be a sort of inflammation if it's not counteracted by antioxidants and things like that. So that inflammation triggers the stress hormone cortisol. Cortisol says, I got this inflammation, I've got a problem, I need to release more, if you will, to take care of that problem. And that's a good response. We want that response. The problem lies where it keeps going. It keeps going and going and going. And so initially the response is not bad, it's just when it keeps going. We keep adding more, I say gluten in our diet, or just having a poor diet in general. But gluten is a big part of that. So it triggers our stress response and output, higher output of cortisol. And long term, what that can do right here is it lowers women's progesterone level. And obviously we know that's important with specifically fertility, but this also goes for many other female hormone imbalances, perimenopause, menopause, things like that. So decreased progesterone, it's called actually the pregnenolone steal or the progesterone steal or the cortisol escape. There's a lot of terms for it. Basically what it's meaning is basically you're robbing Peter to pay Paul. You're stealing, in women, you get all your stress hormone cortisol from progesterone. It's a nice, beautiful biochemical pathway. So when your body demands more from GI inflammation or other things, which I'll get into in other videos, your body wants more of that stress hormone. It needs more. It's got to take care of this threat, basically. And again, that's good. The problem is your body's now not worried about reproduction. It's more worried about survival in a sense. So when we have this increased stress hormone response, cortisol is basically stolen or taken to feed that stress pathway. And that is where we start to see troubles specifically with fertility. Now, this isn't every case. This isn't a diagnosis for all fertility cases or something like that. I'm not getting into that. The infertility docs in town and around in your area are wonderful, and we need them as part of the team. But we're trying to look at things from a nutritional perspective and from a physiological perspective, what happens. And this is just basic physiology. And the hard thing is we don't tend to, this isn't something that we really feel going on. It's not you wake up and, wow, I think my stress hormone sure is high today. I can really feel it. I better, head to the spa for 4 hours to calm down that response, which would be good actually. But so it's hard to think like that. We're used to eating the standard American diet. We're used to eating breads, and we get up in the morning, and this is common with patients, and I hear it from other women. They come up, they'll have cereal, maybe a bowl of cereal, maybe a piece of toast and some coffee. So you're looking at basically a gluten-based breakfast, and not to mention lunch and maybe some things for dinner. Throw in that whole cascade blood sugar imbalances. Again, something that I should get into at a different time. But this whole mess we got going on triggers this low-grade inflammatory response, and again, really puts a demand on the stress hormone, which also increases our or decreases the progesterone output. So I guess with fertility, that's important, obviously, because that's what we're trying to maximize, and maximize progesterone output. And that's why with fertility cases in my office, we look at how the progesterone looks over the entire month, not just one day. We want to make sure that progesterone's not, one, deficient, or two, make sure it's spiking at the right time and being elevated at the right time to sustain pregnancy. So there's a lot that goes in with fertility and optimizing fertility, and that's my goal for women, is to optimize their fertility the best that we can just by getting healthy. And I bring this up because this is a major thing, gluten intolerance and fertility. And like I said, there's some studies that looked at in the past, mainly in Europe, that will talk about the connections there. I don't personally believe gluten equals infertility, but there is probably this autoimmune connection, meaning the body's immune system does not like the protein, and therefore it puts a lot of demand on the stress hormone. So I hope that makes sense, and it's pretty simplistic when you think about it. Increased stress, decreased progesterone levels. Of course, this is long term, not just one single instance. But if you have questions, please post them to our Facebook page or email my office, or even call. That's fine too. We're trying to give women and men, families, help and advice and support on their quest for optimal health. That's where our job is here. So thanks for your time, and I hope to connect with you soon.